Very much. I think that for some time now, we have really not been that active when it comes to behavior change communication activities. It's also because we don't have the resources. If I can recall, I think since 2014, 2015, we have not had money for our civil society organization. Over the years, every region has civil society organizations that they work with, and it is up to the civil society organizations also to partner with local organizations, could be local NGOs or community-based organization in every district to carry out HIV prevention services. And basically, we were looking at education for in-school and out-of-school youth. We were looking at stigma reduction activities, knowing that people still stigmatize against persons living with HIV, and the need for us to also build the capacity of persons living with HIV to understand their human rights so that they will not be abused. And also, as part of the package of the prevention activities, we also have HIV testing services, where community organizations are supposed to move to their communities, churches, and many other places to provide screening services so that people will take advantage to know their HIV status. And the important thing is that when you test positive, it is up to them to also ensure that you are linked to treatment. So basically, the community activities looked at how people can access services and then generate demand for services which are being provided by health workers. We were also providing or doing condom promotion and distribution. So when we talk about the comprehensive package or the comprehensive services which the civil society organizations were delivering, these are some of the things. And so for the past years, about 3 years, we really have not had money to actively engage civil society organizations to work. And so education has basically gone down. It has really gone down.
Is this a challenge?
This is affecting the response to HIV. Seriously speaking, you cannot respond to any epidemic like this. And I have always said that the major route or mode of transmission as far as HIV is concerned is the weakest point of man. What does it mean? Most people who get HIV get it through unprotected sex with an infected person. About 80% of our cases are through having unprotected sex with an infected person, 15% through mother-to-child transmission, 5% through other means, which could be giving contaminated blood or blood infected with HIV, not well screened to somebody, and then using sharps. That contribute to just 5%. And so if the major route is through sex, and as for sex, people have sex. And even as we are speaking, people are having sex. So it means that the best thing is continuously providing education. Every day, just as morning, afternoon, evening, at dawn, people are having sex. Education should also be morning, afternoon, evening. It should be age appropriate. It should take into consideration cultural issues. It should take into consideration community dynamics. And if people are continuing to have sex and education has gone down, then the implication is obvious for everybody to see. But whilst community education is going down, we are on top of issues when it comes to prevention, you can see that there's a lot of talk about the fact that the 90-90-90, the fact that people ought to know their HIV status, and those who are positive should be linked to treatment, sustained treatment, and then we need to continue to monitor them to ensure that their virus is suppressed. And so you realize that a lot of things are going on in terms of treatment. But for the first 90, which is testing, yes, there are a lot of testing, but it must be comprehensive. You don't just go and you are testing. The testing must go with education, sensitization, behavior change communication programs, so that you test, you have adequate information. You realize that in-depth knowledge has gone down. Why has in-depth knowledge gone down? Because education on HIV has gone down. Awareness is high, but awareness does not change behavior. Awareness means you are aware that there is something we call HIV. It is in-depth knowledge which changes people. Means you have the correct information, it is adequate, and you know what to do at every point in time. It is this in-depth, comprehensive knowledge which is able to change people, and that has really gone down. Demographic Health Survey 2014 is clear that in-depth knowledge or comprehensive knowledge on education has gone down. And so it's a big challenge when you are responding to an epidemic like that, when prevention is out and behavior change communications have gone down, and you are testing more and you are linking to treatment. There must be a comprehensive approach in respect to the 90-90-90. It cannot be business as usual. And I want to appeal to government, because for 3 years since 2014, if we are not doing education and every day people are having sex, then we cannot be said to be responding to HIV. We must not do one thing whilst other things are relaxing. They must go together. So we need to do the education, we need to do more on behavior change, and we need to get people on treatment, we need to monitor them, we need to. The 90-90-90 employs a very comprehensive approach. And so government should come to our aid. The Ghana AIDS Commission, we are told, have received some money, and they are going to give civil society organization, but the arrangement is still small. Because if, for instance, Eastern Region had 7 big civil society organizations working with local organizations, it means that every district had something doing on HIV. Now with the arrangement, it's like only one. In a region like Eastern Region, you have only one civil society organization coming to work. It is nothing to write home about, but it's a good beginning. We are expecting that government will prioritize this.